So typically I come across a lot of people who don't go to the dentist unless they have a problem. The teeth are worn down, there are big holes, cavities in the teeth. Well, I have to say India is a powerhouse of technology and talent. Because of our large population, our doctors have a lot of clinical experience. With the social media, every young person wants to look perfect. So we have something called smile design, where
Welcome to MedRoad Map, an information channel from MyMedRoads.com, where global healthcare meets clarity. So when we talk about health, often we overlook the gateway to the entire system, and that's the oral health. A beautiful smile is not just aesthetics. It is also about the confidence and the way of life. So for our listeners in Europe, Australia, Africa, North America, finding world-class dental treatment or restorative dental care can often be the journey of high cost and long waiting periods. Today we are bridging the gap. So we have a very renowned doctor today with us. She is a prosthodontist and implantologist with over 3.5 decades of experience. She has been heading the Department of Dental Care in Manipal Hospitals, and she is currently the clinical director at Lifetime Dental. She has restored thousands of smiles of patients from every corner of the globe. Very warm welcome, Dr. Sharon Colaco Dias.
Thank you. Nice.
So, Dr. Sharon, it is an honor to have you here today with us. You have seen the evolution of dentistry for over 35 years now, from traditional dentures to computer-aided implants, right? In your view, why is India, and specifically your specialized practice, is seeing such a huge influx of patients from across the globe? What is really driving this?
Well, I have to say that India is a powerhouse of technology and talent. We have always had the best doctors. Because of our large population, our doctors have a lot of clinical experience. So they have been good all along. But now we also have technology. We have great machines that help us to make things very smooth for the patient, very smooth for us. Our diagnosis, our treatment planning, and everything is far more predictable. So that is the reason why I think I'm getting a lot of patients that are coming from all over the world. It's becoming more and more often that I see patients from elsewhere.
That's very interesting and exciting for India as well, right? So being a prosthodontist and implantologist, share some information which helps our global audience maybe to take decisions, right? So let's move to a little bit on the geriatric side of the story. So when a patient with, or maybe an individual, not being a patient seriously, is of the age group of 50 plus or 65 plus, what are the common procedures they should be looking at? Many places maybe proactively or as a preventive care from the dental perspective.
So typically I come across a lot of people who don't go to the dentist unless they have a problem. Now those people have neglected their dental health and often come with a lot of attrition. That means the teeth are worn down. Sometimes there are big holes, cavities in the teeth. Sometimes they have missing teeth. And suddenly around 50, 55, they find that they're having a lot of inability to chew, and that's affecting their general life. So in such individuals, we often have to do full mouth rehabilitations, that is put crowns on all of the teeth. And sometimes we need to replace the missing teeth with the help of implants. That is the major changes that I see in the 50 plus age group.
Shifting to the other spectrum, other side of the spectrum on the age group, right? Mm-hmm. So there are now young professionals who, without much of an issue on the teeth, actually they want to look nice, they want to make their smile look beautiful. So what kind of patient influx do you see in that spectrum, and what would be your recommendation there?
So I think with the social media, every young person wants to look perfect, and we have a lot of tools for that. So we have something called smile design, where we can change the way a person's smile looks. We use various things for that. Firstly, we have digital smile design, whereby we can take pictures of the patient and decide beforehand how they would like to look. The procedures that we do that help to make smile design happen are bleaching, that is change of color of the teeth, that's if a small change. We can also do veneers or crowns that change the shape, the color and the shade of the teeth. And we also have realigning, that means orthodontics but with the help of aligners. So it can be done any part of the world. For instance, Invisalign, where we scan the patient's teeth, we make the trays and we give it to them. So they don't have to see us every fortnight or every month. They can have this procedure done on their own in their own countries and just share photographs with us. These are all ways in which we can improve a young person, any person's smile.
Wonderful. So with all this happening, we also have to be mindful that there are individuals with comorbidities, right, across the globe, be it India itself or Africa or Australia or US. So how does it come in the picture? If an individual comes, before getting to the dental treatment, do you also take care of the other perspectives on the individual, certain tests done, and then you help them connect to the network? How does it happen?
So with the comorbidities, initially itself, when the appointment comes to us, we go through the medication list and the problems that the patient has had, and want to have some consents from their doctors from the countries in which they are traveling to us. If that is not possible, then we will connect them to doctors in our country so that they can have certain tests taken and make sure that they're right, that everything is right with their health to continue the treatment. I have been very fortunate because for the last 20 years I've worked in a multi-speciality hospital where I have daily I treat patients with comorbidities. So for me to recognize a problem and deal with it is easy. But we have all the connections in the city and we can refer any patient to any particular doctor that they may need advice from.
Okay, so it's a seamless workflow that you put the patient
Absolutely.
onto,
Yes,
and
yes.
they just don't have to worry about anything.
Absolutely.
Right. Okay, perfect. Now coming to an individual who may be having problems with multiple teeth, right? Or maybe have lost multiple teeth, right? So historically we were aware that it goes for dentures, but now there are a lot of modern technologies and mechanisms and procedures available. Please throw some light on that.
So we have implants for that, where an implant is almost like a patient growing their natural teeth back, because we are making a root which is the implant and a tooth which is the crown of the tooth. We can restore between 1 and 2 teeth to a full mouth. Full mouth rehabilitation with the help of dentures is a very done thing. We are commonly doing it on a daily basis. When patients have no teeth and their bone quality is very poor, and that means they have neglected or they have spent some time before, or they are wearing dentures for many years, then we have a procedure called all-on-4 or all-on-6, whereby we use 4 or 6 implants and restore all the teeth into function. That means from the first molar on one side to the first molar of the other side. This procedure is done with the help of CBCT, that means cone beam CT, as well as intraoral scanners, whereby we make a planning much before we start the procedure, and sometimes we even have the restoration ready. So after the implants, we are able to screw on a temporary restoration for the patient and they can leave the day or the next day with teeth. So that is, I think, the most commonly used and modern way to restore a patient who has many problems or many missing teeth or failing dentition.
So when you say this, personally, I also fear that, it must be very painful. How about that?
Dentistry is no longer painful. We have very good quality anesthesia. We apply a gel so that even the prick of the anesthesia cannot be felt. But for patients who are very anxious, because we can deal with pain, but anxiousness is something that comes from your mind. So there are patients who are absolutely terrified of procedure. It doesn't have to hurt them. It's just a mental thing for them. For such patients, we use conscious sedation. We have conscious sedation in our practice where we use nitrous oxide, which is an anti-anxiolytic. That means it removes the anxiousness. You still know the procedure, you still can feel what we are doing, you are still completely aware, but the fear is removed. I think that's a wonderful tool for people who are afraid of dental treatment.
I think that will give relief to a lot of individuals, right? It's really, no pain, no anxiousness, and what else do you need? You can get your restoration done or rehabilitation done of your mouth. That's wonderful. So now, what about the advanced tools that you're using? Because see, it's very open to ask, I would say, that when an individual is traveling from the Western worlds, where still we feel they have most advanced technologies and high-end technologies, individuals still fear, hey, for cost arbitrage or for minimizing my wait period, I'm traveling to India, but will India give me the best and best of the advanced tools? What about that?
So I think we are at par with any other part of the Western world. We have intraoral scanners that take small photographs of your teeth. So instead of taking impressions, we have our teeth scanned. You can have smile design done with the help of intraoral scanners. We use good imaging like full mouth x-rays and cone beam CTs, that is CT scans, 3D pictures of your teeth and bone, which helps us in the diagnosis before you come in and even during the treatment. So sometimes even after placing the implants, we take the 3D scan, so we are convinced and we are sure that our implants are placed in the right positions. We use nitrous oxide, as I had mentioned before, for very anxious patients and also sometimes for children. Our sterilization is perfect. We use hospital grade sterilizers, autoclaves, so that our area of work is absolutely sterile. That is always the concern for people coming from the Western world, but our sterilization is perfect. So those are some of
So everything taken care of, yes. Nothing to worry about,
Nothing
really, end of the day. So now that we have heard that, you are an expert, right? You are a titan in that space of where full mouth rehabilitation, implant, all this is required. Now, can you help us with a small journey map of an individual who would love to travel to India and do any of these? Like, how would the journey be so that they can plan in advance?
Sure. So we would like to first understand what the patient wants. What is the chief complaint? Is a patient coming in for smile design? Is a patient coming to replace missing teeth? Are they coming for full mouth rehabilitations? Are they coming for root canal treatment? So our the first point of contact would be to understand what the patient needs. If the patient can share with us from their country x-rays, photographs, if possible even 3D scans, that would be great. On the basis of that, we can make a treatment plan which we can share with the patient. See what the patient is that what the patient is looking for? If that is the case, we can make sure that we make a timeline. We can plan that you need to come in and you will need maybe 7 days, or you need 10 days, and we will do this and we will do that, and that is very important. So we can share with the patient what is the treatment plan. That will definitely be an average treatment plan, because clinically examining the patient is the most important. But we can give you a ballpark about what we are going to do, what is it going to cost, and all of that before we see the patient at all.
Okay. So what you say, just to summarize, is that before they travel, right, they can provide you with some basic x-rays, basic information, some photographs that you would need maybe, which will help you work out on a very basic plan or a very indicative treatment plan. And that will kind of little bit back and forth conversation, which will help on freezing the initial plan. And once they travel, definitely you will look at the patient physically, check on him or her, and then we'll maybe tweak around the plan. And I'm sure when we share the indicative plan, we will also be sharing the treatment costs indicative, so there is transparency and there is no big surprises, because definitely the financials is something the patient need to plan as well, right? Perfect. Now, going a little deeper on the technology front, so from MyMedRoads.com, we always say that when you travel to India, there is 60 to 80% of cost savings that an individual achieves if that individual is on the other side doing the similar treatment in United States or Australia or somewhere else. Now, but cost arbitrage is one perspective, right? Because when it comes to health, it's a quality of the treatment. So what exactly beyond price do we ensure on the quality of the materials? What are the different products that you would use during the treatment, which will give them confidence on the world-class nature of the treatment, I would say?
So all the materials that are used for them or for even our local patients are all well recognized materials which can be seen in any part of the world. For instance, the implants that we use are Noble Biocare, that is active, the highest range, and that is very common in the US and most of the world. We also use a brand called Brident Blue Sky, which is very popular in all of Europe. We use materials like 3M, which are, they look and feel the same as it would be any part of the world. So any material that a patient would look at would be something that is recognizable. It is not something made locally or even, I would say, made, it's all very well-known products that are world-class, that are used.
So all international standard products.
All international standard products.
So now now say a patient flying in from London or New York. So what is the timeline that they should indicatively plan, and is there something they can plan? So there must be different phases of the treatment, right? And it's an elective treatment, so maybe an individual would love to have a glance of India, Bangalore, Goa around in between the treatment phases. So how do they do that? How do they plan that?
So this would depend upon the type of treatment that we're looking at, but I find that the most commonly the treatment that patients come for most commonly are implants. For implants, our placement of implant is a one-sitting procedure, more often than not, and I would say a day or two is all I need, maximum 3 days, after which a patient can travel and return to see us again, say 5 to 6 days later, at which time we do a checkup, make sure everything is in place, and deliver to them a temporary solution which they can go back to their countries with. So anything between 6 days to 10 days, we can give you a good solution and let you go home comfortably.
So that is the stay they can really plan here.
That is for implants. If we were to do things like full mouth rehabilitations, that too would be something like we would take a day or two to finish the work. They can go and take a holiday and return to us about 5 to 7 days later, give us a day or two before leaving and leave the country.
So when you do the first phase and the second phase, you say, between which the individual can take a break to look around or go for some meditation programs or holiday or whatsoever it is. So does any treatment happen during the first 2 days, or it's just the checks that happens?
No. All the treatment happens in the first 2 days.
So what about eating? It's dental, right?
So some kind of temporaries are given to them.
Okay.
And there may be some modification in the kind of food they can eat, but they can eat.
Okay, so they can enjoy the Indian cuisine as well, with some restrictions.
Yes, that's
good. So now we have seen the journey more or less on how they can travel, how they can plan, how they can send the reports in advance. And in MyMedRoads.com, we do provide a platform where they can share reports in advance. Now coming back, once the treatment is over, and the patient goes back to their home country, what about the post-operative care and the longevity, right? So do you connect, help, do you be the bridge between the patient and the local doctor there? Do you help them stay connected or have conversations with the local doctor, at least a handover? And if there's challenges when the individual lands to their home country after a few months, if they want to connect with you, at times speaking to a local doctor helps rather than the patient. Does it also happen that way?
See, more often than not, the patient doesn't need any help once they leave from us. But we make sure that we have very good documentation which they can carry with them. Since most of the products that are used are also used in their countries, it is not unfamiliar for any local doctor. Should they need any help or any connection or anybody to answer queries from their doctor, that it can easily be arranged. We can communicate with them on email or on calls. But I find as the passing of time, we've never really had any major treatment problems once the patient goes back or need for connection.
So once it is done, it is like it has a longevity, and it has its longevity of its own, right? It doesn't
For sure.
need a lot of interim cares or
not really,
checks and
but
buts.
we teach the patient how to maintain the restorations, and if they do what has been suggested to them, usually they don't have any problem.
Yeah, and we are a phone call away maybe.
Absolutely.
In case that is
phone
required.
call, email away. We are happy to talk to their doctors if they need. We will document everything and give them with the size of the implant, the name of the implant, the warranty cards of the implant. Everything will be given to them, and they can share this with their local doctor in case they need to do that.
So doctor, with so much of information on the table right now, let's do a rapid fire round. And let's have some fun time also. Most misunderstood dental treatment.
Well, the dental treatments are long and painful.
So they are not really.
Not at all.
One dental myth you want to bust.
That you don't need to see a dentist till you have pain.
Ah. And most individuals do that, right?
They
do wait for the last hour. Most satisfying transformation you see as a prosthodontist.
The ability for my patient to chew food nicely and comfortably and enjoy their food. And two is for younger people who can smile confidently, improves their quality of life.
Perfect. One dental habit everyone should start today.
Brushing twice a day and using some form of device to clean in between your teeth.
Yeah, so there are a lot of advanced devices these days available in the market, right? The electric flosses and all that.
Correct.
Does that really help?
Of course, all of them. Whatever is easy for the patient. Dental floss is actually the best thing, but it's sometimes patients find it very hard to use. Then they can use water flossers, which are much simpler. They're much easier to use in older population or in people who have to be, helped with their dental help.
One question on this is, I have heard many, in my community, I've heard many of my people I know say that if you are using those water flosses, then your gum gets damaged. Is that really a myth or
it's an absolute myth. Nothing happens.
Nothing happens. So twice a day people can use it?
Yes, absolutely.
Perfect. It's really helpful. I have used it and I really find it very, very helpful. You've really demystified the process of implantology, having a beautiful smile, how people can travel across the globe and access to this world-class facilities. I'm really very, very, very thankful to you for this discussion. And more so, it's clear that for a patient traveling from London or Lagos or Melbourne or whatsoever in the world, it's just not buying a plane ticket, right? It's also about arranging some virtual assessments initially, clinical assessments, arranging the logistics, and having a transparency of the cost. And we at MyMedRoads.com can promise we can help with all this in advance before you make your travel arrangements. You just have to take care of your travel, coming to the city of Bangalore where Dr. Sharon is with us, and have your treatment done and enjoy India around as well. Visit us at MyMedRoads.com to start your consultation today. We will speak to you in our next episode. And Dr. Sharon, some final words from you.
I would like to say that India is a great destination for high quality dental work at reasonable prices. We have a dental clinic which is state of the art with 8 dental chairs, intraoral scanners, cone beam CT machines, high quality sterilization and conscious sedation. We have a team of dentists, all very skilled and of different specialities, all available to take care of you.
Thank you so much again, Dr. Sharon. So happy journey for all the individuals who want to embark on this journey of dental treatment, implantology, and a beautiful smile. Bye-bye for now. We will meet you all again in our next episode.
Looking forward to seeing you all. Bye.